How to create a wellbeing strategy. My name's Sara Maude. I'm the founder of the Mind Solution International. And when I'm working with organizations, I often see organizations doing some really great stuff when it comes to workplace wellbeing. But more often than not, what I observe is them doing a lot of activity and investing in a lot of activity and it not being linked to an overall wellbeing strategy. So, for example, there might be organizations that have invested quite heavily in wellbeing subscriptions. There might be some organizations that have identified rising stress levels, rising burnout levels, and as a response to that, they've put on a webinar about stress management. And whilst there's absolutely nothing wrong with any of that, what's going to create more impact, what's going to create greater value and a greater return on investment is when these activities are linked to an overall wellbeing strategy. So if you're looking to understand how to create a wellbeing strategy, or maybe even looking how to refine your wellbeing strategy, then this would be my advice to you. First up is getting really clear on what is it that you're actually trying to achieve. And really thinking about this from a prevention over cure response. You know, really getting clear on what are your drivers, what are your objectives in terms of creating a wellbeing strategy. And speaking to the senior leadership team, speaking to the C-suite team, and understanding what's going to let them know that they've got an effective wellbeing strategy in place. What are they going to see? How are they going to measure this? Which brings me on to your key metrics. How are you going to measure the effectiveness of your wellbeing strategy? Now, it might be that there's an awful lot of things that you're already doing where you're measuring data, you're measuring your key metrics. So looking at things like your HR data, looking at absence, the cost of absence, the number of days lost, the number of people that are on long-term sick, looking at your engagement scores, looking at your pulse surveys, your employee engagement surveys, and looking at the data that's already available to you. And within those pulse surveys, within those employee engagement surveys, is thinking about maybe what questions can you also ask that can really give you that snapshot about the health and the well-being of your people. Looking at things like your customer experience, because we know if people aren't in a good place, that is going to have a direct impact on the customer experience. So looking at things like your customer feedback, looking at repeat business, looking at your sales targets, looking at number of customer complaints, looking at your performance measurements, looking at productivity, looking at your turnover, your retention, all of this data that's readily available that's going to give you a clear indicator about the current reality. And it's going to provide you with very tangible metrics in which you can start to measure the wellbeing strategy against. And what you can use those metrics for is to then create a cost analysis, to be able to build the business case on where it is that you need to invest when it comes to your wellbeing strategy. Then what I would encourage you to do is look at what it is that you're already doing that's working well and how you're measuring that. Because it might be that you're doing some great stuff when it comes to mental health, when it comes to physical health, when it comes to financial well-being, when it comes to social diversity, inclusion, creating that sense of community. Because remember, a well-being strategy isn't just about mental health, it's thinking about all the pillars that feed into our overall well-being. So looking at what's the current reality, what is working. And it might be that there are an opportunity to create some really quick wins. So looking at your strengths, looking at the weaknesses, looking at the potential threats, and also looking at your opportunities. And then when it comes to thinking about the threats, it might be that there are some areas within the workforce that there's a lot of red flags, that these are areas that you need to prioritize. Because depending on the size of your organization, this isn't about going out in one huge hit and doing everything at the same time, because that's just going to lead to a lot of overwhelm. So it's thinking about your overall strategy, maybe for the next 12 months, maybe for the next 24 months, because your wellbeing strategy is always going to be something which is evolving. So looking at what are your key priorities so that you can create a phased approach when it comes to delivering the strategy. Then what I would encourage you to do is also look at your demographics. So depending on the type of organisation that you might have field-based workers. And it might be that they have very different needs, say, for example, to contact centre workers, to people that are on the shop floor, to people that are customer facing. So looking at all of these pockets within the business to identify maybe where there are specific individual needs within the organization, within your workforce, that again, your wellbeing strategy can address as part of that prevention over cure. And then looking at running things like maybe focus groups. You know, the best place to understand what does your organization need is to ask your people. But asking your people and really listening. And it might be that some of the feedback that you get is a bit uncomfortable. It can be a little bit icky because you might think that you're doing a really great job, but maybe some of the feedback, maybe there's a bit of conflict in there. So really running those focus groups and being prepared to be vulnerable yourself, being vulnerable as the leaders, as an organization, and really being prepared to listen to what it is that your employees are telling you that they need. Now, not everybody knows what they need, and that's where it's helpful to work with wellbeing consultants and partners like ourselves. But running things like focus groups, having interviews with your C-suite, with your senior leadership team. So again, we can really start to understand and allow the wellbeing strategy to take shape. And then what it might be that you want to consider before you kind of go out there is even developing the wellbeing strategy and running it as a pilot, running it through a focus group, getting their feedback on what it is that you've identified in terms of your wellbeing strategy. Now, as I said, we don't necessarily need to go all out guns blazing with a wellbeing strategy. So it's really a case of once you've identified what the actual overall strategy is and all of the key tactics, the initiatives that are going to feed into meeting that strategy, where is it that you want to start? Has your organization got the space, the time? Is it the right time to start going out with some of these initiatives? And so thinking about what is it that the organization's currently facing. So if you were going, say, for example, through a huge change management project, or you're going through a big merger and acquisition, it might be that there are, again, certain priorities within your wellbeing strategy that you want to start delivering first. But again, this is the whole purpose of being strategic, is identifying what are your current priorities and measuring those effectively. And, you know, it's about also not being afraid to sometimes get things wrong. You know, if you are doing this on your own, if you're not working with a wellbeing consultant and partner, it might be that certain things that you do maybe don't have the right impact, but not being disheartened by that, being prepared to look at, okay, well, how did we deliver that? And looking at the lessons that can be learned. So for example, you might be looking at running some management mental health training, which I would absolutely say needs to be at the cornerstone of any wellbeing strategy. And it might be that it doesn't have the right impact. And that could be for any number of reasons. You know, maybe you went in with a sort of hitting jelly against the wall approach and hoping that it sticked in the form of a one-day training course. And actually, the lesson learned might be it would have been better to have broken it up into specific modules to be delivered over the series of a number of weeks or months. So being prepared to review the activities, what's worked well, what hasn't worked well, and what can you do to improve those activities. But a big, big part of the effectiveness of your wellbeing strategy is that consistent monitoring, is reviewing it against the metrics, is looking at where is it making an impact and what can we do to enable it to make an even greater impact and provide your organisation and your people with a significant return on investment. So if that's something that you would like help and support on, or you'd like help and support to deliver any of the initiatives contained within your wellbeing portal, then give us a shout, info@the Solution, and I will very much look forward to seeing how we can best support you. Bye-bye for now.